Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and I'm here today with Dr. Jason Gray, who's the CMO over at Mercy. So this is our weekly update on what's happening in the world with COVID. And in the world, we're starting to see a slowing of cases and sort of a plateauing of cases of COVID, and that is truly a good thing. While cases are still active in Asia and the Middle East, we're seeing a decrease in cases in South America and a flattening of cases here in North America. Europe still has got some issues with some countries still having lots of disease, especially in the UK. Israel, which started off early, had a big peak, then went down, and is now having another peak of Delta. So we're clearly not past this, but overall in the world, things are slowing down a little bit. In the US, for the first time in many weeks, we did not see an increase in cases over the last few days, and that is a good sign. You remember in the US, this last Delta surge started in Missouri, moved its way down through Arkansas and Louisiana, then through much of the Southeast. Right now, South Carolina, Tennessee, West Virginia, and Kentucky are really dealing with a large number of cases. But at the same time, places like New York and Pennsylvania really are having a low number of cases. We don't think that's because they don't have Delta. We know they have Delta in those areas, but in those areas, they both had a lot of disease in the past and have a high level of vaccination. In areas that have had a high level of immunity, either from vaccination or previous disease, seem to be doing much better. As we go to the west, Wyoming is just really struggling. Northern Idaho is also struggling. In fact, they instituted crisis standards of care in their hospital, and that means that when you go there, they're just doing the absolute best they can do, but it's not a lot, and it's hard for people in that area because the hospitals are just overloaded. In Oregon, it looks like we've about peaked in our number of cases. And again, Oregon shows places that where the disease is very active, such as Douglas County, Josephine, Jackson County, and some of the counties along the Columbia River. But then there are other areas like Multnomah County, Clackamas County, Hood River County, and Lane County that have considerably lower number of cases. And again, in Oregon, it appears that previous natural infection plus the amount of immunity seems to inversely correlate with the amount of disease. In Douglas County, we're still having a lot of disease, although we're clearly down from the peak. So we were at a time where we were averaging over 150 cases a day. We're under that now, but still averaging about 100 cases a day, which is way, way, way too many. For hospitalizations have been very high. We were at over 110 hospitalizations early in the week. I think we're now down to 102 today, which is still a lot. You'll remember that in the past, our previous high was 21. So 102 is still a really, really high number. And sadly, what we're seeing is more and more deaths. So since the beginning of August, we've had 52 deaths. And those deaths are really tragic. Now, when we look at deaths, some of them people are older, some of the people are younger, many of the people have pre-existing conditions, but we're now seeing some that don't really have a lot of pre-existing conditions. And so it is scary to see that. We are noting that vaccines still seem to work. When we look in the hospital every day, we look into people in the hospital and look at their vaccine status. Generally, when we've had over 100 people in the hospital, only a few of those have been fully vaccinated. Now, we also look for partial vaccine status, and partial vaccine status is a little harder to know. Some of the people may have gotten one vaccine a day before they were diagnosed. That's obviously not going to have much help. If they had two vaccines and were 10 days out, they should have a lot of protection, but we don't see very much of that. So again, almost all of the people are either totally unvaccinated or fully vaccinated. And so it really does appear that full vaccination clearly protects against cases, still probably 70 to 80%, and protects very well against hospitalizations, probably 90%. So the hospital is still full, and this is really our big concern. So Jason, tell us what's going on over at the hospital.
Hey, Dr. Dannenhoffer, thanks for the opportunity. Good afternoon. So in the hospital, both good news, cases are down slightly. You know, we were at a while, we peaked at 89 cases during our peak. We're now down in the low to mid 60s of hospitalized inpatient COVID patients on that. So that's a positive trend we're starting to see. Unfortunately, what we're seeing though is the ICU remains full. on that. The ICU remains full of very ill patients at this point, in all ages. The earlier surges we saw, mainly older. This time we're seeing a broad range from the 20s all the way up to the 80s still on that. And what we're noticing is they tend to be sicker and stay in the ICU longer. Completely agree. When we look at the vaccination status, roughly 90 to 92% of the patients that we see, especially in the ICU, are unvaccinated on that. So vaccines clearly are helping to protect against severe disease and hospitalizations on that. Again, the ICU remains full. Quite a number of those are on ventilators, assisted respirations on it. Continue to working. Staff are working hard. We, for a while, were at crisis standards. We're beginning to be able to back off slightly from that. Staff are still working quite hard. Great thanks and appreciation to the National Guard and some of the additional travelers that we've had are really helping to focus on the care. We continue our vaccination efforts, again, for our staff on that, and continue with Regeneron, which is the monoclonal antibody, Dr. Dannenhoffer, you might want to talk about. We ran a little low. Our supply was replenished. We're back to administering on an outpatient basis with a provider's order.
Yes, Regeneron is something that we've talked about on our Facebook Lives for many months. So Regeneron is a combination of monoclonal antibodies. And so what these were is antibodies that were raised against the ancestral strains, then propagated in the lab, and then they can be given to people either who were exposed to disease and are very high risk, or for people who have disease and have risk factors that might wind them up in the hospital. And so this can be given either as an IV infusion or it can be given as shots, and seems to be pretty protective in preventing hospitalizations. I think the data out there suggests it's about 80%, and certainly varies on when you get it and what your underlying conditions are. But I think what we've seen in town is that people who've gotten Regeneron have had a lower rate of hospitalization than people not. The trouble is that giving Regeneron takes a fair amount of time and effort. And while we're having so many cases in a day, it's hard to get it to everyone who needs it. If we were down to 10 or 20 cases a day, we could easily give it to the 5 or 6 people a day who were at the highest risk and further decrease hospitalizations. So we like Regeneron a lot. The problem is we think there's going to be some ongoing small shortages like you've seen.
Yeah, our small scale, what we've noticed is the patients who've received Regeneron, only about 4% of them are subsequently admitted after. It's a little lower than the admission rate. So again, small scale, smaller numbers, close to 100 at this point, but it does show that there is some promising benefit.
Yeah. So in general, in Douglas County, about 8% of people who get COVID get admitted to the hospital, and that's of everyone, including young kids who don't have much risk of getting admitted. Since you've given this Regeneron to the highest risk people, and only a few have been admitted, suggests that it's working as we expect. So we really like Regeneron, and we're hoping that we can further get that out there. And this is one of the reasons that we want to go ahead and push off the pandemic as far as we can, so that Regeneron and other medications can become more widespread. Now, there had been some rumor that there are a lot of people in the hospital with side effects of the vaccine. Dr. Gray, have you seen that?
I've heard that rumor also, and no, we have not seen that on it. So here in the hospital, I can assure you, every COVID patient is ill with COVID, proven by labs. I have not seen, other than the usual minor side effects, sore arms, maybe a little bit of low-grade fever for a day or two. None of our patients are here because of a significant life-threatening side effect. We vaccinated, many of our staff, well over 2,000 and ongoing. And of those personally, very few side effects other than, like I said, fever, maybe little myalgias, muscle aches for 24, 30 hours. That's been it. Overall, it's been very impressive on how well most people tolerate it.
And so one of the questions that came up was about oxygen supplies. We know in other countries, oxygen supplies have been limited. And certainly in India, it was really tragic, the number of people who died because there was no oxygen available. How does the hospital get oxygen, store oxygen, and what is your supply?
So our supply has been very good. we early on in the pandemic anticipated this might be a shortage, so we actually increased our stock levels of oxygen and have the oxygen supplier deliver more often per week. We have not had shortages with oxygen here. So in the hospital, good. It actually comes out of the Puget Sound area. It's trucked down in a compressed liquid form on it. So we're doing well. There are shortages in some areas, as you mentioned, both of oxygen, but especially of the oxygen cylinders, the tanks that people might use at home or outside of the hospital setting. One of the efforts that we've done with you and Douglas Public Health Network, really try to anticipate and stock up appropriately as we can, so that our community members, our patients, our loved ones wouldn't have a critical shortage of that.
So I understand at this point, with the hospital being so full, that the hospital is not currently doing surgeries that could be postponed for a while, or some people call them elective surgeries. Tell us what the status on elective surgeries at the hospital is.
Yeah, that's been a confusing situation. Due to needing to reallocate a majority of our staff and our resources to the COVID patients, we did make a difficult decision, it was about 2.5 weeks ago now, to halt temporarily what would be considered elective or non-emergent, non-urgent surgeries on that. We still are, and are also focusing in on taking care of those emergent and urgent procedures. So if you come in with a car wreck, or you have a fall and have a hip fracture, or an infection, or an appendicitis, we still are performing those surgeries on them. That's the balance, the give and take, by postponing some of the more elective things, like an elective screening colonoscopy, frees up the resources to both take care of COVID patients and also these urgencies. We look at it every week, week by week. We kind of have to guess what are the volumes going to be. If things continue the direction they're going at this point, I'm optimistic that hopefully in the next 3-ish weeks, we should be able to resume, at least partially, some more of those elective procedures on it. Just because we call them elective doesn't mean they're not important on it. And we realize that, and we want to provide all ranges of care for it. So thanks for letting me clarify that, Dr. Dannenhoffer. Appreciate it.
And then you are still having help from the National Guard. Tell us what the National Guard members who are working at Mercy are doing.
Yeah, we really appreciate the National Guard's men and women. They've been great on that. They are non-clinical, so they are in supportive roles on that. They might be serving as screeners at the entrances. They're assisting with turning patients. Many of these COVID patients have to be turned from their back to their front multiple times throughout the day to help with the breathing. That takes additional people to do it safely. They're assisting with that. They're assisting with cleaning rooms, or bringing supplies, or stocking, even things such as transportation. They were able to help us out to drive up to Portland a couple weeks ago to pick up a ventilator for us. So they have been really important, and we can't emphasize enough our appreciation to them for their willingness to serve us.
So people care so much about Mercy and having a viable community hospital where we can seek care, where our family members can seek care. So what would be your recommendations for people to do to keep Mercy healthy and open?
So agreed. The hospital and the staff have felt that. I do want to express our thanks and our appreciation to the community for the support, the tokens they've seen. That is appreciated, makes a huge difference. So right now, the common sense things to stay safe on it, from basic hand hygiene, avoiding large congregate groups right now. Definitely consideration of the vaccines. What we've seen here, the vaccines prevent hospitalizations, they prevent severe disease. I know there's a lot of concerns and questions. Really encourage you to talk with a trusted healthcare provider about that on it. From my standpoint, from our staff standpoint, we do support the vaccination. The other thing I would recommend is, it's the summer, people want to be out there on it. Enjoy the summer, enjoy your activities, but don't take unnecessary risks right now. The last thing we need is somebody who's never skateboarded trying to do a 360 backflip right now. Maybe not the best time to go jump your Banshee or your ATV right now. Just the common sense things we normally recommend. Yes, we can take care of you, but let's not stress the system if we don't have to.
Well, great. That's great advice. I promise you I will not be doing a 360 on my skateboard this week.
All right.
Did you have anything else to add? Thank you so much for joining us today.
No, it's our pleasure. I do want you to know that the staff here do greatly care about the community on that. There is all kinds of information, misinformation. If there are questions, concerns, please bring them to Dr. Dannenhoffer. I'm always open to address questions. I want to make sure that the public has the correct information and has the transparency that we can give respecting patient privacy.
Thank you again for joining us. Again,
Hey,
this
our
is Dr.
pleasure.
Bob
Thank you.
Dannenhoffer here with Dr. Jason Gray. Thank you again.